Halifax, the provincial coordinator for sexual health Nova Scotia applauds a new federal plan to help fight sexually transmitted infections, but says Nova Scotia still has a long way to go when it comes to accessing testing and treatment. The Pan-Canadian Sexually Transmitted and Blood-Borne Infection Framework for Action was approved June 29 at a meeting of federal, provincial and territorial health ministers. It outlines national goals for reducing the spread of infections like HIV, hepatitis C, gonorrhea, chlamydia and syphilis. The office of the Halifax Sexual Health Centre on Quinpool Road, which offers a range of services like STI, pregnancy and HIV testing, as well as sexual health education. Halifax Sexual Health Centre, Facebook. We are concerned about the access to testing and to treatment for sexually transmitted infections as well as the financial support that's available for doing prevention education around that here, Connor Felvey of SHNS said in an interview. Because there's such a crisis in primary care in Nova Scotia, a lot of people simply don't have access to a healthcare provider that can test them or treat them. Felvey said there also continues to be a lot of stigma around sexually transmitted infections, which can deter people from discussing their sexual health with a family physician even if they do have one. Article continued below. She describes lack of access to testing and treatment for sexually transmitted infections as a serious gap. The Halifax Sexual Health Centre offers a safe and free option for anyone seeking testing or treatment for sexually transmitted infections. Read more. Online hookups and fewer condoms may be behind rising STIs in Canada. Doctors should push for STI testing. Doctors notes, but no sexual health centre outside Halifax has a nurse or doctor on staff, which means they can't provide testing. I certainly know that the sexual health centre here in Halifax sees a lot of people from all around the province because they travel in if they're able. Sometimes it's their only option, she said. There's definitely a real struggle to access care in rural communities. The further away from Halifax that you are, the more trouble that you're in. The article continued below. Felvey said that needs to change. She hopes the new federal plan will help bring attention to the lack of services here in Nova Scotia. It's always helpful simply to have any level of government say out loud that they're committed to sexual health and fighting sexually transmitted infections, because I think a lot of the time people don't really grasp necessarily how significant this issue is and what an impact it has, she said. The health impacts of sexually transmitted infections can be quite significant, particularly if they're left untreated, which is sadly frequently the case because a lot of them are asymptomatic, so people don't necessarily know that they're infected. The federal plan notes that sexually transmitted blood-borne infections remain a significant health concern in Canada, even though they are largely preventable, treatable and in many cases, curable. The Public Health Agency of Canada reports infection rates of chlamydia, gonorrhea and syphilis have been steadily climbing since the 1990s. Felvey said this further highlights the need to work toward improving access to testing and treatment for all Nova Scotians. She said the federal plan offers a good starting point, particularly since many different groups are working on education and advocacy around sexual health. For example, health clinics work on it, women's centers work on it, schools work on it by doing education, so it's really good to have a sense that there are strategic goals that we can all be pulling towards. Felvey said, I think that we still have a long way to go with working on this, but I definitely think of this as a forward step. Star Metro reached out to the province's health department for comment on access to sexual health resources but did not receive a reply by deadline. Yvette D'Entremont is a Halifax-based reporter covering health, environment and education. Follow her on Twitter, @ed'entremont.